The fungal infection releases over 40 different types of toxins into the bloodstream. So you can imagine with 40 different toxins entering into your bloodstream, you're going to feel a little tired, you know what I'm saying? You might have some headaches. You just might not be feeling well at all, okay? And that oftentimes, again, not always, there's no black and white in healthcare or any other area of life, unfortunately. Don't we wish there was? But with the fungal infection, very oftentimes the person has trouble with their ileocecal valve. Because again, if it's digestive related, you know, if it's found anywhere in the digestive tract, and it could be found anywhere. It could be in the small intestine, the large intestine, or like I said, outside of the digestive tract. But often, it's systemic. It's throughout the whole body. And very often, the person enjoys things that are sweet and tasty. So, like fruit and candy, soda pop, brownies, Pop-Tarts, tortillas, bread, pasta, rice, potatoes, sweet potatoes, yams, that kind of thing. Brown rice, oatmeal. Okay. So, the whole point that I'm making is that it's very, very important for healthcare providers to do their best to become more aware about this ileocecal valve syndrome and to treat it structurally, chemically, and emotionally by addressing the causes. Now remember, again, I'm going on and on and on for a good reason, because it's so important. If somebody has trouble with their ileocecal valve, which is right here, my belly button is here, and my hip bone is here, and the ileocecal valve is in between the two places. So if somebody has trouble with that ileocecal valve, because they have trouble with diet, allergies, parasites, and emotions, emotional therapies are very important to help with the healing of that valve. 99% of all of our neurotransmitters are made in the gut. They're not made in the brain. They are not made in the brain. That is not true. They are made in the gut. They affect the brain. They function in the brain. They're very important for proper brain function. Crucial, in fact. But they're not made in the brain. They're made in the gut. And you've heard people say, well, I kind of have a gut feeling about this. I don't think we should go over there, or something like that. They really do have a gut feeling. Those emotions are coming from their gut. That's where the neurotransmitters that allow us to have the emotions that we have come from. They come from the gut. They do. And so that's where that expression comes from. So again, diet, allergies, parasites, and emotions. If a person has trouble with their ileocecal valve, they're going to have trouble with almost all of those things, most likely. And so they really need somebody who can diagnose the health concern. It's literally, according to, I know you may not be a healthcare provider if you're watching this. If you are, God bless you. And if you're an acupuncturist, God bless you twice. If you're an acupuncturist, you realize that the bladder and kidney meridians are directly related to each other. They're a paired meridian. And the ileocecal valve syndrome is an imbalance between the bladder and kidney meridians. So you'll find kidney 5 on the right, kidney 5 on the left will be quite active. And I take that back. Kidney 5 on the right will be active, and bladder 58 on the left will be active in an open ileocecal valve syndrome. And in a closed ileocecal valve syndrome, you'll just find bladder 58 bilaterally active, meaning that they're tender to the touch upon deep palpation, meaning when somebody pushes in vigorously in those points, those acupuncture points, the patient will have the jump sign, meaning they have a lot of pain and they'll kind of jump. Okay, and so sudden low back pain, ileocecal valve. Tinnitus, ringing in the ears, ileocecal valve. Carpal tunnel syndrome, need to get a surgery, maybe not, ileocecal valve. Pain on, both toes or both knees, not sure why though, okay? Ileocecal valve syndrome, very oftentimes. What else? Shoulder pain that just doesn't seem to go away. Bursitis, ileocecal valve syndrome. Okay, so always good to find a healthcare provider who can help you with that. And the applied kinesiologists are, if they have the proper training at least, they're